Hi, everyone. Good afternoon or good almost evening. Thanks for joining us for our last briefing of the transition. I want to start by just giving you a brief overview, and then I'm going to introduce or bring in Jeff Zients, who you all know as the COVID coordinator for the incoming Biden administration. But last night, President-elect Biden spoke to the nation about his American Rescue Plan. This historic rescue package will fund vaccinations and help contain COVID, deliver direct, immediate relief to those hardest hit, and support struggling communities. And earlier today, or just a few hours ago, the president-elect spoke about his plan to administer COVID-19 vaccines to the US population. So I'm happy to have Jeff Zients, who's helping lead that effort, oversee the team, join us just for a few minutes today. So I'll turn it over to you, Jeff.
Well, thank you, Jen, and thanks to all of you. I want to take a moment just to step back and give some context here. Earlier this week, 4,000 people died in a single day. In hospitals across the country, beds are overflowing, and we're nearing 400,000 deaths total in our country. 400,000 deaths. It's clear, as the president-elect has said, we are in the midst of a dark winter. And the reality is that the current administration, the Trump administration, has never had a federal comprehensive strategy. They've never put the infrastructure in place to ensure that vaccinations make it into the arms of the US population. This is clearly a national emergency, and we need to treat it like one. So starting on January 20th, we're going to throw the full weight and resources of the federal government behind managing this crisis. Yesterday, you heard the president-elect lay out an historic emergency legislative package to change the course of the pandemic. Today, you heard him talk directly to the American people about his plan to vaccinate all Americans. Now I want to spend a few minutes on the highlights of the vaccination plan. There are 4 basic areas of focus. First, allow more people to get vaccinated. Second, create more places for people to get vaccinated. Third, mobilize more medical teams to get shots in arms. And fourth, increase supply to meet the demand across the country. Starting with allowing more people to get vaccinated, we still see doses of vaccines sitting in freezers unused, while people who want the vaccine can't get it. So we will encourage states to begin opening up eligibility to include anyone 65 and older. People 65 and older have accounted for about 80% of the deaths from COVID in the country. So anyone 65 and older, and frontline essential workers like teachers, first responders, and grocery store employees, and other frontline essential workers. This doesn't mean everyone in these groups will get the vaccine immediately, and in fact, it will likely take months based on what we know about vaccine supply. But it will mean that as vaccines reach communities, they're administered to people instead of sitting on freezer shelves. Second, we'll create more places for people to get vaccinated. We will work with states to establish community vaccination centers. These will be federally sponsored mass vaccination sites in places like stadiums, gymnasiums, community centers. CDC and FEMA will provide funding to states for supplies, including dry ice, laptops, protective equipment, and technical assistance for logistics, like managing the cold storage chain. The storage is not easy for these vaccines, as you know, so that management requires expertise, transportation, and shipping. Mobile clinics will ensure that our plan touches the hardest hit and hardest to reach populations. And the administration will launch, our administration, the Biden-Harris administration, will launch a new program to ensure that federally qualified health centers can directly access vaccine supply where needed. These health centers serve more than 30 million patients per year, many of whom are people of color, and they will be a critical partner for us going forward. We will also make vaccines available in local pharmacies. 90% of Americans live within 5 miles of a pharmacy, and we're used to going to the pharmacy for flu shots and other medications. Third, we need to mobilize more medical teams to get shots in arms. The federal government will help mobilize thousands of clinical and non-clinical staff, including experts from federal agencies, Public Health Service Commission Corps officers, military medical personnel, and first responders. We're also going to expand the pool of qualified medical personnel, including retired healthcare workers. We'll provide resources to the states to help cover the cost of personnel and administrative staff, and we will begin 100% federal reimbursement of states' deployments of their National Guards. So take the 75% current level up to 100% federal reimbursement. Last, increasing vaccine supply and getting it out the door faster. Until recently, the current administration's policy of holding back significant doses of the vaccine supply had certainly slowed down distribution. President-elect Biden's plan will substantially reduce the amount of supply held back by the federal government, but continue to maintain a small reserve for any unforeseen circumstances. We want to be clear here, very clear, that we are committed to following the schedule recommended by the FDA and ensuring everyone gets 2 doses of the vaccine. Starting on day 1 next week, we will work closely with the manufacturers to monitor production and supply. We will use the DPA, the Defense Production Act, to work with private industry to accelerate the making of the materials needed to supply and administer the vaccine, from tubes and syringes to protective equipment. I also want to emphasize the continued importance of testing. While we're working to get as many people vaccinated as fast as possible, we need to double down on testing. The administration has asked for $50 billion from Congress for testing, enough to provide timely diagnostic tests and to screen asymptomatic people. Testing and screening is critical to getting kids back into school, helping businesses reopen, and protecting people in congregate living. Testing is also critical to identify any new emerging strains of COVID-19. The US is 43rd in the world in genomic sequencing capacity. 43rd. That is clearly unacceptable. The legislative proposal calls for resources to significantly increase our country's capacity for genomic sequencing. In closing, I want to make clear that this is a fundamentally different approach from the Trump administration. This will be an all of the federal government approach in partnership with states, tribes, territories, and local leaders. The president-elect has developed this plan in consultation with a world-class team of top health advisors and with a focus on equity. His COVID-19 advisory board has informed our work, and we meet daily with Doctors Murphy, Walensky, Nunes-Smith, Kessler, and other public health experts. This is an approach based on science and informed and managed by a dedicated group of experts. As the president-elect said, there is a path out of this darkness. We will certainly encounter challenges, many challenges along the way, but we will work to be honest and transparent with the American people and to get everybody vaccinated as quickly as possible. Until we do, until everybody's vaccinated, we need everyone to do their part to protect each other. As the president-elect has said, we all need to do what we know works. Wear masks, practice social distancing, wash our hands, follow basic public health guidelines. Together, we can do this. With that, Jen, I'll hand it back to you. And again, thank you for giving me the time.
Sure. Thanks so much, Jeff. And I know you've got a few things on your plate, so we'll let you go, but also we'll welcome you to the briefing room next week or forward after that, whenever you want to join us. So thanks again for joining us today.
Thank you again. Thank you.
All right. I just had a couple things I wanted to highlight. I know this was a week very full of news, but last night, as you all know, the president-elect gave a primetime address. He laid out the American Rescue Package, as I touched on the top. This aggressive $1.9 trillion package will change the course of the virus, put Americans on better footing, put our economy back on track. As Jeff outlined, this package will invest $20 billion in a national vaccination program. It will also scale up testing to stop the spread of COVID, providing $130 billion to help schools safely reopen, protect vulnerable populations, and more. It will also finish the job on providing $2,000 in direct financial assistance to working families. It will get grants to more than 1 million of the hardest hit small businesses to help them get back on their feet, invest $20 billion in Indian country to support tribal governments. And for those of you who aren't following the developments of Moody's, I just wanted to highlight Moody's, an independent Wall Street firm, said Biden's plan would help create more than 7.5 million jobs in 2021, double economic growth, and return the economy to full employment a year faster than without the rescue package. And as he noted last night, this is just the beginning. In the coming weeks, he will announce a jobs and economic recovery plan, a second package that will put us on the path to build back better from this crisis. With that, I'm happy to take your questions. And I realize it's fully after 5 o'clock now, but a lot going on this week. So we want to take some time to do that. Who's first?
Great, we can take our first question from Ella Nelson.
Hi, Jen. Thanks so much for doing this. I wanted to see if you all had any details about the first couple weeks and doing confirmation hearings, and also how this emergency relief plan that the president-elect rolled out will go through Congress at the same time that there is a potential impeachment trial happening in the Senate. Thank you.
Sure. Thanks, Ella. And first, let me say that since we went through this an impeachment trial just a year ago, there is some precedent. Last year, Senate committees held hearings every single day of the impeachment trial. And so the precedent is clear. The Senate can do its constitutional duty while continuing to conduct the business of the people. And since that time, the crisis, the pandemic, the economic recession has only grown worse. So as I noted, and as you all know, it may feel like longer than this, but the president-elect just laid out his proposal last night. Our team has been already busy on the phones, engaging with Democratic offices, Republican offices, having discussions about this plan and the path forward. But our expectation and hope and belief is that we need to walk and chew gum at the same time, and need to find a way forward to do that. And we will be working closely on the mechanics and the process with Senate leaders and Senate offices on exactly how to do that. Who has the next question?
We can move to Jonathan Cohen.
Thanks, and thanks for doing this call. I have two sort of specific questions. One is whether you guys have any insight into whether Pfizer and Moderna are actually producing vaccines at the rate they've proposed. Are there any signs that their production is below that? And have you been able to get that information from the Trump administration? And then the second related question is 100 million over 100 days, so that's 1 million a day. That's faster than it's going right now, but that would not get us to herd immunity anywhere near the summer. And I'm wondering, have you guys sketched out for after the 100 days, do you have like a pace or a trajectory you want to be on?
Sure, Jonathan. Well, first, as you know, because you've been covering this closely, we have not received, there was a bit of a delay in us receiving information from the outgoing administration, and we're hearing and learning about a number of issues in real time. So it's really going to take our team being in the buildings, on the ground, running the government in order to really have a full assessment. So I don't have anything more for you about the pace for Moderna and Pfizer, one way or the other. But I would just reiterate something that Jeff said, which is that we are committed to the timeline recommended by the FDA for the second dosage. And as he also noted, there are a number of steps that we want to take from day one to expedite that process. We also know it's not going to happen overnight, and that's also something that the president-elect made clear today. On your second question about the pace following the 100 days, it's a great question. I expect we'll have more to share with all of you in the coming months as we roll up our sleeves and get to work. But right now, we're really focused on doing everything we can to meet that initial goal and deadline, or objective that we've set out.
Cool. Thank you.
Great. We'll take our next question from Soon Ming Kim.
Hey guys, thanks for holding the briefing. Going back to the impeachment trial question, Ron emphasized earlier today that the transition hopes that the impeachment trial is a quote, not a quote lengthy one. So two questions. Does that mean the president-elect wants Speaker Pelosi to transmit the article of impeachment to the Senate as soon as possible? And would the transition prefer that the House impeachment managers not call witnesses, since that would inevitably prolong a trial?
Thank you for your question. I will say that, we are going to continue to work closely with them behind the scenes, have conversations about the mechanics and the pace and the operations and certainly how it will move forward. But our focus continues to be publicly and privately on ensuring that we can move forward with Congress on getting this bold package that the president-elect proposed last night moving, including consideration, discussion, negotiations, and of course, hopefully hearings on this moving forward. So I don't have anything to read out for you specifically in terms of the timeline or additional details at this point.
Great. We can take our next question from Molly Nagel.
Hey, Jen, thanks so much for doing this. Just to follow up on that last question, President-elect Biden has talked publicly about asking the Senate parliamentarian about that bifurcated process he previewed. Has he gotten an answer from the Senate parliamentarian about his inquiry? And to turn to the COVID vaccine after that, have you guys gotten any sort of a briefing about the reserves that currently exist within the United States, or any numbers on the vaccines that are currently on hand, given the new reporting today?
Thanks, Molly. We will continue to be closely coordinated with Democrats and Republicans, including the leader McConnell and incoming leader Schumer about the pace and plans and operations and mechanics of how everything will be moving forward. We will really defer to them on engagements with the Senate parliamentarian and discussions on that moving forward. But we'll remain closely coordinated with them in general on, of course, our primary objective of getting this bold package forward, but all of the business that's happening in Congress at this point in time. And in terms of the amount of reserves and the pace of vaccinations, as I noted a little bit earlier in response to Jonathan's question, we are hearing and learning about a lot of information in real time. And while certainly there have been additional briefings and engagements in the last week, they haven't been at the pace or depth that we would have hoped. And so we are looking forward to getting to work next Wednesday, and we'll have a greater assessment of where things stand at that point in time. But we remain committed and confident, given all of the steps that the president-elect wants to take, the team he's brought in, to reaching our objective of getting 100 million shots in the arms of Americans by 100 days.
We'll take our next question from Kayla Touche.
Hi, guys. Thank you so much for doing this. I really appreciate it. I had two questions, both looking at the agenda for next week and the week after. Now that the relief package or the rescue package is out there publicly and many stakeholders and lawmakers have weighed in, when do you expect negotiations to begin in earnest with leadership on both sides about evolving this package into a version that is something more passable? And the second question is, what is your estimate for the soonest that we could see a full confirmation for any of the cabinet nominees who will see committee hearings on Tuesday? Thank you.
Sure. Well, let me take the second question. There are a number of hearings that have been set for next week that were not set earlier this week. So we certainly see that as an encouraging sign for a number of our national security experts and nominees who will play pivotal roles at this time in our, in our country, and obviously keeping the American people safe, and obviously accounting for emerging threats around the country. In terms of when they could seek, how early they could be confirmed, well, that's really up to the Senate. And, there is a lot of past precedent, a great deal of past precedent of votes happening on the day of the inauguration, the day after the inauguration. And we are certainly not just hopeful, but we are urging fast action on getting these nominees into place to lead these agencies, to ensure they're in place as close to day one as possible. But we have seen some positive movements this week. There's more that needs to happen in the coming days. And then your first question, I didn't write it down and I should have. I'm going to just blame the fact that it's after 5 o'clock and it's been a long week. Can you?
Yeah, happy to. So the question was just about, now that so many stakeholders and lawmakers have weighed in on the contents of the original rescue package as it was laid out last night, when do you expect to sit down with leadership on both sides to try to make edits and any changes to make sure that it's a version that is passable?
Well, as you know, it's a process, and we're just at the beginning of the process. There was a great deal of consultation in advance of the president-elect's speech last night, and that continued in earnest today. A great deal at a staff level, because obviously the president-elect has just a few things on his plate, but it is something he will be engaging with on the phone, in engagements with Democrats and Republicans in the coming days. So I can't give you an exact timeline other than to say that there is an urgency in moving this forward. We don't expect that the exact version of the proposal will be exactly what comes out of the sausage machine once negotiations are done, but we're at the beginning stage of the process, and just we're eager to move it forward and spend time on the phone doing exactly that. So, it's top of his agenda, hence he gave a speech, a primetime address before he even was inaugurated.
Great, we'll take our next question from Justin Sink.
Hey, Jen, thanks for doing this. Appreciate it. I was wondering if you could give, I know there's been a lot of moving parts, kind of a run of show of what you now understand the next week leading up to and including Inauguration Day will be. I know there's still a lot of moving parts, but obviously some things have gotten locked in. So when the president-elect's coming down, what we should expect for him in Washington, and if at all possible, some sort of preview of his address. And then I also had kind of an oddball question that made me think back to the Obama administration, which was in the Obama White House, you guys published visitor logs regularly. And I'm wondering if that's something that we should expect to continue once you guys get into office. Sure.
Well, Justin, we will have more to say about our ethics policy in the coming soon, I promise you. We do want to ensure we are a transparent White House, and that we do follow a lot of the, we plan to follow a lot of the excellent, policies that were put in place by the Obama administration. I would, remind people, I wouldn't expect many visitors in the early months, especially during COVID. It will be quite limited, but we will have more to say on that soon. On the inaugural and next week, you are right that there are a number of pieces that are still being finalized and still locked in. And we certainly understand the eagerness of everybody to know what the plans will be and what the specifics will look like. We do know the president-elect will be sworn in on January 20th. That is certain. He'll take the oath of office with his family by his side, and we're looking forward to that. But in terms of the mechanics and all the specifics, we hope to have something more specific to lay out for you early next week. And on the inaugural, again, I don't want to get out of him. He'll be spending some time working on it this weekend. Obviously, he is coming into the presidency in a moment of crisis in the country, as he's talked about a great deal. He wants to use the moment to call Americans to unity. So there are some themes I think you can certainly anticipate, but he'll be spending some time on that, as he has been, but especially over the coming days. And I expect we'll have more to preview for you more substantially early next week.
Take our next question from Catherine Lucy.
Hi, Jen. Thank you. Following on what Justin said, can we talk at all about what the first day and first 100 days are going to look like beyond the COVID actions? Are we still expecting executive orders on things like the Dreamers and other issues on day one? Other executive orders to follow? Legislation on issues like immigration? If you could walk us through anything like that, that would be helpful.
Yes, we are close to having a lot more that we can preview for you. He is looking forward to delivering on the promises that he made when he was running for president. And he has talked extensively about a number of the executive actions he wants to sign as quickly as possible in the early days of his presidency. We'll have more specifics to lay out for you on what that looks like, but you can anticipate that he will use the power that every president before him has used of executive action to help deliver immediate relief to the American people, to do some work in addressing the 4 crises he talks about frequently, from climate to the economy, to our need to rebuild our place in the world, to, of course, COVID and the health crisis our country is facing. But we'll have more to preview for you on that in the coming days. We're getting close. There's a lot more news to come, even before Inauguration Day, I promise.
We'll take our last question from Annie Linsky.
Thanks so much. I appreciate it. Just sort of following on the news today that there's a phone call between Mike Pence and Vice President-elect Kamala Harris. Could you just outline any more of the role that you see Pence playing in the inauguration, whether he'll be invited to any of any sort of pre-events or post-events, or appearing with the sort of Biden-Harris team at all, beyond just sort of sitting on the sort of dais or in the audience?
Sure, Annie. I mean, beyond, I know we're speaking about a range of issues here. I mean, I'd certainly point you to the inaugural committee team on that, but beyond his plans to attend, which the president-elect certainly welcomes, I'm not aware of additional events he's attending, but we can certainly circle back with you if there's more details on that to share at this point in time.
And has there been have there been conversations between Pence and Biden at all?
No additional conversations, or no conversations beyond the one with Vice President-elect Harris that I'm aware of.
Thank you.
Sure. Thanks, everyone. Have happy Friday, and we'll do this again next week, and I won't be wearing slippers. So that's sort of sad, but I'll look forward to seeing you all next week, and we'll have much more to preview for you about the inauguration, the address, more early policy plans in the coming days. So thanks for your patience on that as well.